Diabetes Connections is brought to you by One Drop, created for people with diabetes by people who have diabetes. By Real Good Foods, real food you feel good about eating. And by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Simms.
This week, Dr. Natalie Strand is an anesthesiologist who was diagnosed with type 1 as a teen, and she says people who live with chronic pain and people who live with diabetes have more in common than we may think.
The person who lives with it is thinking about all day long with every activity, before they go to bed, when they wake up in the morning. But the people around them, even loved ones, in the same household, kind of forget because you look healthy.
Dr. Strand just contributed to a paper all about pain management guidelines in this difficult time when many people can't see their doctors face to face. You may also know her as the winner of The Amazing Race in 2010. Of course, we talk about having type 1 in that crazy travel show. I'm a huge fan, by the way. In Tell Me Something Good, virtual events, firefighters, and a Lego master. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am so glad to have you along. I'm your host, Stacey Simms. We aim to educate and inspire about type 1 diabetes by sharing stories of connection. And I am so excited to finally talk to Nat Strand. I can't believe that we haven't crossed paths before. I'm a huge fan of The Amazing Race. As I mentioned, I started watching it in 2001 when I was pregnant with my daughter. And I actually remember the commercials when it was like coming soon. And then, of course, September 11th happened. And how are they going to be able to do this? They thought the show might not have a second season. So, gosh, that was such a long time ago. But it is amazing to see that even with COVID-19, which stopped the show again, they're going to be continuing that in the future. But that's neither here nor there. I mean, we're talking to Dr. Strand about pain management, her life with type 1. And of course, we'll talk about The Amazing Race as well. But she won it with her partner and fellow doctor in 2010. So taking a look back. I want to bring you up to date before we get to the interview about something new that I just announced really a couple of days ago on social media. And that is my Book to Clinic program. Of course, the book is The World's Worst Diabetes Mom. And one of the things that I have found really fascinating is that although I am obviously a layperson who wrote an advice book for parents of kids with type 1 diabetes, I've been really fascinated by two things. One is that adults with type 1 are buying and reading the book and then giving it to their parents to talk about, their childhood if they were diagnosed as a kid, or who wanted to learn more about the parent perspective, which I thought was fascinating. But I'm also hearing from diabetes educators and endocrinologists who have told me, and I know I sound surprised here, and this is genuine, I'm not trying to make this silly. They have told me that they have learned things from the book. And, when you think about it, it really isn't a surprise because it's the layperson perspective. These are things you do not learn in medical school, right? These are things you learn when you mess up diabetes, when you're at the beach, you're in the car, it's the middle of the night, and you're MacGyvering stuff together. This is stuff you learn when you live with type 1. And to that end, a few clinics reached out and said, can we have copies of the book to give away? And so I started a new program. It is called Book to Clinic. Bottom line, I'm looking for sponsors to pay for these books so we can get them to people who need them. It's very reasonable. It's a very easy system. I will put more in the show notes, and there's a video that's on social media. You can see the whole thing and how it works. Big thank you to my first two sponsors because the books have already gone to clinic. Thanks to T1D 3D Gear and big thanks to Frio. So, I really appreciate the faith that they have shown. And if you have a product or a blog or another podcast and you're looking for some very reasonable advertising that is targeted to an audience that is looking for you, please let me know. And you can reach out, Stacey at diabetes-connections.com. I'm really excited about it. It's one of those things that you just don't expect to happen, but we'll see where it goes. Diabetes Connections is brought to you by Real Good Foods. And they have already new ice cream flavors. We love their ice cream, and they're kind of hard to get right now. They've sold out of a couple of flavors, but man, they are so yummy. I cannot wait to try the Mocha Java Chip ice cream. I'm a huge fan of coffee and chocolate. And their original flavors that we tried way back when, beginning of March, I think we did that Facebook Live where Benny and I tried the ice creams. They were so delicious. We really like the mint chocolate chip. Everybody in my house loved the peanut butter chocolate chip ice cream. We're big peanut butter people. The new flavors sound amazing. I mentioned the mocha java chip, the cake batter ice cream. My kids love that. And something called super premium almond charcoal ice cream. That sounds amazing. So let me know what you think if you've sampled the new flavors. We haven't been able to try them yet, but I'm really excited. And of course, Real Good Foods has real good food. They have a whole line of high protein, low carb, grain-free, gluten-free, good for a keto diet if that's your thing. Everything from cauliflower crust pizza to stuffed chicken and breakfast sandwiches. Find out more. Just go to diabetes-connections.com and click on the Real Good Foods logo. If you've already heard of my guest this week, chances are you're a big fan of the Amazing Race TV show. Dr. Nat Strand won the whole thing in 2010, part of the first all-female team to cross the finish line first, along with her friend and race partner, Dr. Kat Chang. Dr. Strand is also the first winner with diabetes, and she might really still be the only contestant to compete with type 1. I started watching The Amazing Race, as I mentioned, when I was pregnant with my daughter, and I have been meaning to talk to Nat for a long time. I'm so thrilled we finally worked it out. She's an anesthesiologist and a pain medicine specialist working at the Mayo Clinic in Scottsdale, Arizona. Recently, she contributed to a paper on caring for patients with pain during the COVID-19 pandemic. She was diagnosed with type 1 at age 12, so we have a lot to talk about. Here is my interview with Dr. Nat Strand. Dr. Strand, thank you so much for joining me. I am excited to learn from you and to hear your story. I followed you for years on social media, so thanks for coming on.
Oh, well, thank you so much for having me. It's an absolute pleasure.
So much to talk about. We will get to the stories and living with diabetes and your diagnosis story. I want to start out and just jump right in with what caught my eye recently, which is a study to which you contributed about caring for patients with pain during this pandemic. I don't know that you can really share too much about the study, but I'm curious, you're an anesthesiologist. Let me start with asking you, what are you seeing right now? What's going on in your world?
Where I'm located in Phoenix, Arizona, we are thankfully not experiencing the surge that we thought we were going to have. So 4 to 6 weeks ago, there was a lot of work as far as preparing on a community level, all the hospitals, governor mandates to increase capacity of hospital beds, things of that nature. So we were certainly preparing for a surge, but I think a lot of people in our community have made personal sacrifices with the social distancing and to stay at home. And I think that has helped us flatten the curve, as they say, not quite bend the curve because we're still increasing cases here, but flatten the curve. Right now, what I do is to practice pain medicine. We largely transitioned to telemedicine to avoid face-to-face visits and allow patients to access health care while they stayed safe at home. So predominantly in the last few weeks, I have been treating my patients with telemedicine.
And how does that work? Because I would imagine that pain management is already a very delicate balance. We hear about, you don't want to take too much of this medication or you can get addicted. And then when people are concerned about not seeing their doctor face to face, you've got to be worried about, are they even managing their pain or are they suffering? Can you share a little bit about how it's been going?
I think for the most part, it's been excellent. With two-way real-time audio and visual, I think you can get a good sense of how patients are doing. And as far as managing medications, certainly the opioid crisis was there before the COVID pandemic. The opioid crisis is still there during the COVID pandemic. So, it's not, the answer isn't just to, prescribe a bunch of opioids. Now, some people benefit from it, but a lot of people can be managed with other types of medications, whether that be anti-inflammatories, neuropathic pain medications, lifestyle alterations, weight loss therapy, and even with, the social distancing and stay at home, there's a lot of physical therapy that you can do from home too. So I think this challenge in medicine is really forcing our hand at taking advantage of telemedicine and taking advantage of remote care and certainly providing access without being face-to-face. Now, we are now open for elective procedures in Arizona, so we are able to see patients face-to-face. But for a period of time there, we really were forced to jump on the telemedicine bandwagon maybe a little sooner than most of us were prepared to do. But I've been very pleased with the ability to offer access to patients, especially patients who are at higher risk, whether that be due to health concerns or age, or even for patients that had to travel long distances to see a physician. So I think easing the burden on those patients in their situations to allow a little bit lower barrier to entry as far as healthcare access has.
Pardon my ignorance on this question, but when I think of seeing a doctor for pain management, and fortunately I haven't had to have a lot of that in my life, so again, I'm ignorant on this, I don't think of an anesthesiologist, right, as the person that I would see. I think of you all in the operating room.
You're not alone. When you do a residency in anesthesiology, you basically spend 3 years after your internship focusing on ICU level care, operative care, regional anesthesia, so like nerve block, epidural catheters, those kinds of things. So you become an expert at acute pain management, both with medications and with interventions. So there's a fellowship option afterwards. And one of those anesthesia, you can go into OB anesthesia, you can go into cardiac anesthesia, you can go into intensive care, you can also go into interventional pain medicine. So you kind of utilize that interventional skill set you developed during the anesthesia residency, and you further hone that to then focus on maybe spinal injections, radiofrequency ablations of the spine or large joints, implantation of spinal cord stimulators, or implantable pain pumps. So, it doesn't seem like a natural progression at first glance, definitely, but when you kind of think about what we do in the OR and how that can translate to an office setting for chronic pain patients, you kind of can see the bridge to the specialty.
Yeah, of course that makes sense. So tell me about this study, because this is all about caring for patients with pain during the pandemic, not necessarily patients with COVID-19. This is something that is more of a guide for physicians.
Correct. These are recommendations. We worked with the American Society of Regional Anesthesia and Pain Medicine to put out recommendations. And then we also, the paper you're referencing was an international paper with the European Society of Regional Anesthesia also. And we just kind of wanted to provide some guidance during this pandemic early on, how to handle urgent procedures, semi-urgent procedures, what was the risk of using steroids, what could we do to manage our patients that were on chronic opioid therapy. So it really was sort of a set of guidelines after a discussion of a panel of international pain medicine experts.
It does seem that chronic pain, as I read through a little bit of the study, just the introduction, things like that, it seems like chronic pain is so debilitating, especially for older people. I know we're a diabetes podcast and we're going to talk about diabetes in just a moment, but is there, any advice that you would give someone who is suffering, who feels like, I don't think there's something for me. I've had this pain for so long. I'm afraid of being addicted. We hear all those stories. Any reassurance?
Absolutely. And one thing I want to say, you reminded me when you talked about this being a diabetes podcast, is I think there are a lot of similarities between living with chronic pain and living with diabetes. I mean, they're totally different disease states, but if you talk about an invisible disease that the person who lives with it is thinking about all day long with every activity, before they go to bed, when they wake up in the morning, but the people around them, even loved ones, in the same household, kind of forget because you look healthy or you look okay, so
yeah.
That experience of living with diabetes is very similar to the experience of living with chronic pain.
That's really interesting, especially, and even to my question of people are almost afraid to speak out because they're afraid that they won't be taken seriously or they'll be blamed. I didn't even think about that.
Yeah, I mean, and, you don't want to be a complainer. You want to put on a happy face. You feel like it's not interesting to other people because it's the same thing it was yesterday. And so, I think living with diabetes myself, I bring a lot of that to counseling people who live with chronic pain because I get it, and a lot of times they feel really, you can tell they kind of feel like, oh my God, that's the first time anybody's ever really related to me on that way of what, more than just diagnosing the underlying cause of their pain, but actually what it means to them to live with a condition like that. So I think that actually me having my experience of living with diabetes helps me relate to patients who live with chronic pain.
So let's talk about type 1. Let's talk about your experiences. You were diagnosed as a young teenager, really preteen, age 12. Do you remember your diagnosis story? Right back in just a moment to Nat telling her story there. But first, Diabetes Connections is brought to you by OneDrop. And I spoke to the people at OneDrop and I was really impressed at how much they get diabetes. It really does make sense. Their CEO, Jeff, was diagnosed with type 1 as an adult. In fact, I just talked to him last week about something else. It's always so good to talk to him because he gets it. He knows what this is like, right? OneDrop is for people with diabetes, by people with diabetes. The people at OneDrop work relentlessly to remove all barriers between you and the care you need. Get 24/7 coaching support in your app and unlimited supplies delivered. No prescriptions or insurance required. Their beautiful, sleek meter fits in perfectly with the rest of your life. They'll also send you test strips with a strip plan that actually makes sense for how much you actually check. OneDrop, diabetes care delivered. Learn more, go to diabetes-connections.com and click on the OneDrop logo. Now back to Nat, and I had asked her if she remembered her diagnosis story.
I do. I remember that summer being really annoying on my family's road trips. I remember going up to northern Arizona and having to stop to use the restroom all the time. And it's a short, 2-hour drive. So I do remember my parents saying, well, stop drinking so much. You know, of course, now we know it's the opposite. And then I went to a 3-day sleepaway camp. And at camp, I was getting some notoriety for how many cans of soda I was drinking. I was going to the vending machine and I was drinking so much to the point I built a pyramid of all the cans. I think obviously I was going into either some DKA or, just hyperglycemic diuresis. So I came home. My dad is a radiologist. He started to suspect that I might have diabetes. And I think he brought home some urine ketone strips or something and tested them. And I remember it was black. So he actually took me into the hospital. And I remember him telling me I was going to the hospital. And I had this bag of gummy bears in my room. And I vividly remember looking at those gummy bears. And, in a typical kid, that was what I was sad about. I was oh, I'm not going to be able to eat those gummy bears. I had no idea what the rest of the diagnosis meant. But at that time, you were admitted. I think I stayed in the hospital for 10 or 12 days and learned how to give myself injections and carb counts. And there you have it. That was kind of my diet. It was fairly non-traumatic in a way. I mean, I didn't have some big bad event that unveiled the diagnosis. It was kind of suspicion. Then that was the summer before I went into middle school. So I got to carry a purse everywhere filled with diabetes supplies. I thought that was pretty cool.
Did you know you wanted to go into a medical field when you were that age?
No, I don't think so. I had dreams of being an oceanographer or a National Geographic photographer, kind of more creative, worldly, growing no roots type of careers. But it wasn't until later. I think I had an interest in medicine through diabetes and my, you get a lot of exposure to physicians and hospitals at a young age. But it wasn't until I was in college that I really solidified my desire to go into medicine.
And what made you choose anesthesiology? Do you remember having a process for that?
Well, it certainly, matters a lot about what rotations you get. And if you have a great attending on a certain rotation that makes, just kind of lights it up for you. And that kind of happened to me for anesthesiology. I had a rotation as a third-year medical student, and I just had a series of phenomenal attending physicians who let me, place IVs, let me place lines. I intubated patients. I was in on some bigger cases. And I remember at the time, which of course you change your mind on this as you get older, but at the time I wanted to be, really where the emergencies happened. I wanted to be, a first responder. I wanted to be someone went down and had an emergency. I wanted to be there to be part of the, traumatic. And now that I'm older, I kind of am no, I'd like something with office hours, where nobody needs you at 2 a.m.
Right.
So, but at the time, I wanted to be right in the heart of the action. And there's nowhere better for that than being, in an operating room every single day. And you get to help people. It's often the most terrifying thing they've ever done. And you have just moments for them to establish trust with you. Or even with pediatric cases or, even on babies, a parent literally hands you their baby and then you take it down the hallway. And so there's this intense trust that needs to develop over a very short period of time. And I always felt like that was something I really held sacred as that amount of trust that someone had in me for their loved one or for themselves.
We have had to have, an anesthesiologist. We've had surgery, both of my children, over the years. And I always, in the consultations or when they come in, I always say to the anesthesiologist, you are the most important person in this room. And I try to say it when the surgeon's not around, but I don't care. Because to me, that's the one. And it is such a huge responsibility. And I have such respect, almost awe. And when you said, you take your child down the hallway, if you've been there like I have, your heart is in your throat for the entire time. And it must be such intense, not only the training, but just the experiences that you go through. Do you all, again, this is kind of a personal question. Do you all have a community? Do you help each other out? Do you think there's okay mental health among anesthesiologists? Because that's got to be so difficult. So that's a huge weight to bear.
It's a huge weight to bear. And I think, I don't want to pretend like I'm on the front lines right now because, again, I do outpatient pain medicine for the majority of my practice, but especially some of the anesthesiologists that have been called to intensive care units and that are on COVID airway teams. And some of my best friends from training are in hospitals that are saturated with cases in other states. And so I think the mental health is a huge issue. The amount of stress, the amount of burnout, the amount of anxiety, the amount of fear, even about, PPE and that kind of thing, especially in the beginning, when some of the supply chains weren't, as mature. Again, I'm not talking about my personal experience, but people at other hospitals. So, I think in general it's an issue, and I think acutely it's even a bigger issue. I do see resources. I think people during the pandemic are very aware. I even read a story about a physician's suicide in New York, an emergency medicine physician. So people are aware, and I think there are resources available now, especially that are free for physicians. But in general, I think mental health is unfortunately still kind of has a stigma where in medicine, I think self-care is often last care. People go to work when they're sick for the most part. People go to work when they're tired. People work long hours overnight, into the next morning. So I think mental health kind of goes along with physical health, and, you just kind of do what needs to be done and the needs of the patient come first. And so for a lot of physicians in all specialties, I think self-care, including mental health, really is a challenge.
I have to ask, well, I have an anesthesiologist who also has type 1, and I mentioned, my kids, one has type 1 and one does not, have both had surgeries where they required hospitalization and anesthesia. Are there any best practices or any bits of advice that you can share with the diabetes community to help us make those hospital stays? We're not talking about COVID-19, obviously, but, more routine stuff. Is there anything that we can do or better prepare so that when we go to the hospital, if it's an adult or a child with type 1, that we can kind of help the healthcare teams take better care of us?
So I think one of the things is to try to speak with your anesthesiologist ahead of time, if possible. So if you're having a planned surgery and you know who the group is going to be, you may find people within that group that have a little bit more experience and interest in managing type 1. That would be number one, is to really see if you can identify someone. And even if there's not someone who has specialized experience, just so you can come up with a plan, I would definitely suggest having a plan with your endocrinologist written out that can be given to the anesthesiologist. I'm thinking of when I've had surgery or when I, had my C-sections with my kiddos. I think that having the endocrinologist involved so they can, give their support. And of course, the anesthesiologist is going to do what they're comfortable with and what they know how to do. And sometimes that's changing, insulin pump to IV insulin. And you also have to balance that with if someone's not familiar with it and they don't have trust in it, they have to administer the care that they have trust in. So there might be some education involved. Of course, it depends on what the case is, the length of the case, the intensity of the case, those kinds of things. So I think if you're able to, if it's a short case and if the anesthesiologist is comfortable with the plan, I would love to always keep my insulin pump on and my Dexcom on. But I do know that sometimes that's just not possible and you have to switch to, other types of insulin. So it's kind of uncomfortable for everybody. But I think if you can communicate ahead of time and create a plan that's most comfortable for everybody involved, that's important. And of course, whatever's going to keep anybody safe, avoiding any hypoglycemia, avoiding any severe hyperglycemia, and of course, just getting you to the other side when you can take over management yourself again.
Yeah, what we did the last time Benny had surgery, because the first time he had surgery, he was teeny tiny. I think he'd been diagnosed he was 7 or 8 months in. So he was still 2, and he had no Dexcom. He did have an insulin pump when this was like 13 years ago. So everybody was all excited to see the pump. It was very interesting. But he did great. And then this last time he needed surgery, he had knee surgery late last year, and they were amazing. But we decided that it would be easier for the anesthesiologist to just look at his Dexcom numbers on his pump, not his phone, because the pump, you unlock 1, 2, 3, right? The tandem pump is super simple. We figured the phone could lose signal. The phone could be harder to unlock. He's got like a 6-digit code. And why would I remote monitor from the waiting room? What the heck was I going to do? they would know. They would know I had faith. They were great. And it really worked out well. So it was a really positive experience. And interestingly, in the 12, 13 years that had gone by, that hospital staff was really well educated about pumps and CGMs, which was a really pleasant surprise for us. So that was good.
Yes, that's awesome.
All right. So I think I'm not alone in that the way many of us were introduced to you was on national television, was on The Amazing Race, which is, it is the best reality show. It's my favorite of all time. I started watching it. I looked this up the other day, Nat. I couldn't believe it. I started watching it in 2001 because I was pregnant with my daughter and I couldn't sleep. And I used to watch it all the time and I adored it. And you guys won it. I know a lot has been said, a lot has been written over the years about this. What was that like? I mean, what do you most remember about it?
Yeah, that was 10 years ago now, which is really crazy. But, there's the experience of doing The Amazing Race, of traveling around the world with nothing. I mean, you have a backpack, but you're going to the Arctic Circle. You're going to go to sub-Saharan Africa. You're going to go. I mean, we didn't know exactly where we were going to go, but I'd watched the show myself enough times to know I'd be really cold, really hot, really dirty. But you have a backpack. You have no money. You have no maps. You have no cell phone. You have nothing. And so just being stripped down to sort of your just immediate resources to figure things out like that, that was as interesting as it was to see the world. I mean, I had never been so stripped down of things I had access to. Being a studier, I always had references for everything. So you kind of just get thrown into the world and open a clue and say, make your way to Stonehenge. You know what I mean? It's not like you get directions. So it was wild. I did it with one of my very best friends, who's another anesthesiologist, Dr. Kat Chang. And we had a blast. We went around the entire globe, and I think it took us 21 days total. And then I came home and slept for like 6 weeks. And after that, the show starts airing in the fall, and it airs from September to December, or it did at the time. So watching it was a whole nother like phase 2.
Oh, yeah, with all the editing and the production that they do, too.
The production, what the other teams were doing. You see a lot of backstory or parallel stories that you didn't see at the time, right, because you were just with your team. So it was very interesting to watch it after having lived it. And then I think phase 3 of it is getting to be like a C-list celebrity for a year or two, which was also very weird. So there's like 3 phases of The Amazing Race that totally have kind of changed my life. But overall, it was so positive. I have nothing but fond memories of doing it and the people that I met. And I also remember thinking the world was a lot safer and friendlier than I would have thought. You just drop off to Bangladesh for 48 hours with no plans, people just kind of helping you, and you're frenetic and you're tired and you're racing and you run up to strangers and you ask them questions really quick. And, now I would never go to Bangladesh for the weekend. You know what I mean?
Right.
It seems like so much work to go somewhere for a weekend, but it was worth it. You definitely got to see things and get a taste of it. So afterwards, I tried to tell myself, even if you don't have a huge chunk of time to go somewhere, still go if you can and to see the world. And everybody was friendly. I don't think I had one time where I felt like somebody was, rude or aggressive or unwelcoming. And I think that was a very wonderful experience too, because sometimes I think we can kind of become afraid of going places or being with other cultures, and being there in person in so many different cultures, and having everybody be so warm was phenomenal.
Did you learn anything at that time about managing diabetes? Because I know you were stripped down, but you had your diabetes supplies. But I saw the show, you're testing while you're driving. I mean, to some extent, you don't have all the stuff, you're not sleeping right. You're not eating right. And I'm just curious. I think sometimes with my son, he'll go and forget something and muddle through, and he learns from that. And even though we have all this wonderful technology, he kind of has learned that he can make it work. He can always MacGyver something. I'm curious if you had that experience.
That's the word I was just thinking. I mean, any type 1 becomes, kind of a MacGyver, where you're learning how to, if you need to, draw insulin out of an old reservoir for a new one, or you're learning how to reuse parts of an infusion set because one part ripped off, but you don't have enough to replace the whole thing, or you're learning how to keep insulin cold, or you're learning how to package things so they don't take as much room by taking them out of their packaging and putting them in a Ziploc, all together. I think, I remember even the test strips, opening the test strip bottles and filling one bottle with 2 bottles worth of strips just to save space. So, you kind of by force have to get very creative with space and efficiency and also problem solving so, yeah, I learned a lot about traveling with diabetes. And, one of the things I did was I typed out a letter that said I have type 1 diabetes. In case of emergency, please help me get sugar, or please, help me get insulin, or take me to a hospital. And I printed that out in several languages. So, if I found myself in Russia, for example, and didn't know how to say what I needed, I would have that kind of to give. So I think, just learning how to prepare, anticipate what problems you might have for where you're going, and then, trying to bring the solutions with you as much as possible. That was definitely a skill set that was honed.
That's a great point. We were in Israel a while back, and, we were on a guided tour and everyone spoke English. But at one point, a guy wanted to take my son's medical bag to examine it, and he didn't speak English. And then he figured out what was going on. Our tour guide kind of spoke to him, and he was like, kind of funny, exasperated, like, come on, make this simple for me. And he wrote out, "This is a medical bag," in Hebrew, and attached it to our bag. He was like, "Here, now you won't have any other problems." Like, what's wrong with you people? Why couldn't you have just done that to begin with? He was very funny back to us, like, nicely exasperated with us. But I think in the future, that's something that is just very helpful. This is a medical bag, or I have type 1 diabetes, in different languages. That's great advice. So I mentioned you have 2 children now. You have, I was going to say toddlers, but you have preschoolers, right? 5 and 4 years old. You mentioned C-sections. I'm not going to get all personal about type 1 pregnancies and that sort of thing. But when you were diagnosed at 12, I doubt you were thinking about children at the time. But, as you were getting older with the diabetes diagnosis, did you think about children? Was this something that you thought might be difficult or not possible with type 1, or was it always in the plan?
I actually, again, fitting with my adventurous plan for life, I wasn't one of those girls that really thought I would have kids. I never really thought about being a mom and stuff like that. I kind of was more thinking about how I was going to travel the world. And so, we had all seen Steel Magnolias. And so I think, I had this awareness. But at the time, I think it was more of an awareness that movie was wrong. I think I thought it would be fine if I had wanted kids. And then it wasn't until I got a little older, I met my husband, we got married, and my switch flipped, and I was like, I need children. And then it was like, okay, I started getting into the details of, diabetes and what the control needed to be and what the risks really were. And, that I think was overwhelming. I think, a type 1 pregnancy it's definitely a full-time job. It's not regular diabetes management. It is like very, very intensive diabetes management. And so I knew that people with type 1 could have kids. I just didn't know if I could do what it would take to be that strict for that long. So I think I pleasantly surprised myself that I could. I think when the stakes are there, you do your best. But, I think there are different personalities, obviously, that have type 1. And my brother also has type 1. He was diagnosed in his 30s, and he's very mathematical. He's got an engineering mind. And I think not that anybody is well-suited for diabetes, but if someone was to be well-suited personality-wise, he is. He is regimented. He charts everything. He faxes things. He's like that. And I'm the opposite. I became like him when I was pregnant.
So speaking of your kids, though, you've said you've been doing mostly at-home consults for your work. I assume that for the last couple of weeks, at least, you've been home with your kids, maybe more than usual. How's that going?
Well, I think that everybody will look back on this time with different experiences. Some people are bored and they've organized every room in their house and they've baked all these new recipes. And I will look back on this time and remember when I had a 3 and a 5-year-old who didn't have anywhere to go and any preschool or any daycare and tore my house apart all day long every day. So my couch cushions haven't stayed in place for more than 20 minutes this whole time. It's just crazy, but
it's got to be exhausting.
They're like feral animals. It is, but it's been cool to see them develop their relationship. They're playing together from sun up to sundown. They're imagining things. They're making our yard, a jungle. So it's been nice to see them spend so much time together. But certainly being at home with 2 young kids and nowhere to go, that's not for the faint of heart.
I salute you. Before I let you go, I know, as you've said, you're not in the ICUs right now. You're not seeing patients with COVID-19. But as a person with type 1, I assume you're trying to stay on top of the medical literature and, seeing what this may mean for people with type 1 who get it, who catch it, who are at risk. Can you talk a little bit, just either, your thoughts for yourself, advice for the community? I'm just curious what's going through your mind on this these days.
Well, when it first kind of came out, I was reading a lot about what had happened in China and also in Italy. And when I saw diabetes, I kind of assumed it was type 2 diabetes, because we were seeing a lot of age-related and comorbidities. But, we've now seen with position statements from like the ADA and the JDRF, that they're not really differentiating type 1 and type 2. So, I know for me that my risk of catching this is not higher because I live with diabetes, but my risk of a more negative outcome definitely is higher because I live with diabetes. So, the way I look at that is I'm doing all of, the recommended social distancing, masking, staying at home, those kinds of things. And at the same time, I'm using this as an opportunity to really focus on all other aspects of wellness. I'm kind of re-engaging to bring my diabetes control into a tighter range because I know that's helpful, as far as like rest, nutrition, exercise. All of those things are sort of, you can think of it as like prehab instead of rehab, what you can do before you deal with something to make you as resilient as possible physically. So I would just say, our risk of getting it's not higher, but our risk of complications if we do get it is higher. And that's something that I think we should not it should not cause us to operate from a place of fear, but rather from a place of preparation and using that knowledge to just, get our diabetes under the best control possible, whether that means, changing to a pump or getting a CGM or just re-engaging with your endocrinologist or CDE. And then I think making sure you consider all other aspects of wellness too, to make you more resilient, which is, nutrition, rest, stress management, and exercise. So I think we can use this knowledge to just put ourselves in the best position possible. A great defense is really the best offense in this case.
Well, thank you so much for talking to me, for sharing your story, and for just giving us a little bit of an insight into the medical community these days. I really appreciate it.
Oh, and thank you so much for having me. I mean, like you said, I followed you on social media for so many years, and it's just an honor to be included on your podcast. And thanks for everything that you do for our community. We all appreciate it very, very much.
You're listening to Diabetes Connections with Stacey Simms.
That was so nice of her to say that at the end. It's funny, isn't it, the diabetes community? We all kind of know each other from social media, or, we've met at a conference, but there's a lot of mutual admiration out there. It's always nice when people say that. But, as you listen, it makes me think, if for some reason you feel like you're not really a part of this community, maybe you listen or you're lurking in the group and you've never reached out, and you're wondering if, what's it like? It's great. Definitely reach out. Definitely jump in. I mean, if you're fine and you just want to listen, that's awesome. But we're doing a lot of really fun stuff in the Facebook group with Zoom calls and surveys. And I'd really love to see you there. And I really want you to know as you listen that your voice is really important too. So I'll link up more about Dr. Strand and her study and other information that we talked about in the show notes. There's also always a transcript there at diabetes-connections.com. And up next is Tell Me Something Good, which is all from the Facebook group this week. I love it. But first, Diabetes Connections is brought to you by Dexcom. Now, we have been using the Dexcom G6. I looked this up. It is 2 years now. We did a goofball video 2 years ago, a little bit over, actually. It was the night that Avengers Infinity War came out. And that's the night that we slapped on the G6 for the first time. And we did a Facebook Live. And poor Benny wanted to do it, but he was also really reluctant because he wasn't sure if it would hurt. So I will link up that video, but I will tell you when I link it up where to start because it's like an agonizing 10 minutes before he does it. But the Dexcom G6, FDA permitted for no finger sticks for calibration and diabetes treatment decisions. You do that 2-hour warm up, the number just pops up. And after so many years of the previous Dexcoms where you had to calibrate a couple of times a day, you wouldn't get any blood sugar readings till you did so. It's amazing. We have been using the Dexcom for almost 7 years now, and it just keeps getting better. The G6 has longer sensor wear, now 10 days, and the new sensor applicator is really easy to use. You'll see on the video, he was shocked, no pain. Of course, we still love the alerts and alarms that we can set how we want. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. To learn more, go to diabetes-connections.com and click on the Dexcom logo. Tell me something good this week. A bunch of great, I'll call them little stories from our Facebook group. Last week, I talked about these big athletic accomplishments, right? The Appalachian Trail, marathons. But this week was a little different, and I think these are worth celebrating as well. James said AP exams were easy on accommodations this time, simply allowing students with type 1 double the time so they could test, treat, etc. during what was already a weird testing cycle. That is good news. Samantha says, we sent out birthday cards to any kid among our friends that had a birthday this month since they can't have a party, and that was really fun. Her husband and her son are training for the new virtual JDRF ride, and they all just signed up for the Disney run again in January. She also wrote, we are all alive. I see you, Samantha, in that sense of humor. And speaking of the ride, Elizabeth wrote in that the reimagined JDRF My Ride is good news, and she'd like to see me talk about the new program with one of the managers. We have that in the works. I'm going to be talking about that. So the JDRF rides in person for the fall, unfortunately, were canceled, which I think was the right thing to do. But, you know, there are a lot of people who really enjoy that, and we're banking on it, and we're already fundraising. So JDRF My Ride is a way for people to participate, even though they can't travel to these locations. I will put more in the show notes on this, but I will also be doing, hopefully, a whole podcast on it soon. Yerachmiel Altman, who is part of the Facebook group, wrote in, I don't know if this is what you're looking for, but I will be hitting 39 years of pumping the second week in June, and I hit 23 years of CGM use in March. He will mark 59 years with type 1 in November. I had him on the show a while back. He was an early adopter of diabetes technology. In fact, he worked in the industry for a while, so really great stories from him. Perry, who lives with type 2 and is in the group, I'm always happy to see him. He said that his dad survived heart surgery that he has needed since March and finally had the valve repair last week, which would have been early May. Perry works with the fire department in South Carolina, and he says, good news, my crew has not lacked masks, gloves, or hand sanitizer yet. And I got to say, this is my favorite of the week. My dear friend, Ann Sutton, who is also the outreach manager for our JDRF, is so creative trying to keep people connected online. And she created 2 events for children who, aren't able to meet up right now because we do a lot of that in our area. So she created, and this isn't just for girls and it isn't just for boys, anybody could go to anything. She created a tea party, a virtual tea party, and she created a virtual Lego build. And I'm going to share the photo of one of the kids built a meter out of Legos, and it's unbelievable. It looks so good. So I'll be sharing that, and I hope you check it out. Really good and creative stuff. Do you have a tell me something good story? It can be, I think this is a great example of what I would call, these smaller stories, but still big accomplishments, good news in our community. I mean, if you're running a marathon or you're celebrating 59 years with type 1, we want to share that too. But I just love this segment because it gives us a glimpse into the good stuff that's happening. You can share it in the Facebook group, or you can ping me, Stacey at diabetes-connections.com, and tell me something good. Before I let you go, I'll tell you a story about something bananas that happened in my house recently. And I think this might be the first chapter in my next The World's Worst Diabetes Mom, because that book stops really right in the middle of middle school. And it's not as though we haven't continued to make mistakes. So I will tell you the punchline first, in that everything is fine. Benny is fine. It's all good. But what happened was he had a day, just one of those perfect storm days, where the Dexcom had expired. He accidentally left his pump off. And of course, a few hours later, he was very, very high. Now, since COVID-19 and we've been around each other so much, I've actually been less on him than I think I have been any time in recent memory. His bedroom in our new house is upstairs. Mine is downstairs, which is totally new for us. We have Control IQ with the tandem pump, which has been a dream. And he's doing really, really well. But, things happen. So it's about 6 or 7 o'clock at night. He realizes he's having the pump issue. Of course, he didn't have the Dexcom. So, we didn't know that there was an issue for a lot longer than we would have otherwise. We did a blood sugar check and it just gives you that high. There's no number associated with it. And of course, we did all the protocol you're supposed to do. Huge shot, gave him the correction by injection, changed the pump inset, slapped on the Dexcom, drank a ton of water, and checked for ketones. And I went downstairs because Benny never has large ketones. I mean, in all of his years, he's had medium once. I'm knock wood. I'll knock on anything I can get. But, he's been high for a sustained amount of time through illness or just wackiness or, dumb stuff with diabetes. and he's never had large ketones. But we still do check because I just don't want to get lulled in that complacency, right? People change, things go. I don't want it to slip. So he texted me and he said, Mom, the keto stick is black, which we've never seen before. So of course I run upstairs and I look at it and it's super dark purple. So I'm like, all right, well, you just had the injection. Because it's a urine stick, it's probably a couple hours behind. Drink a ton of water. We'll monitor from here. If in 2 hours we still get a really dark, large ketone reading, we'll call the endo and he'll walk us through what to do next. Okay, so I'm freaking out, right? And I'm thinking to myself, why don't I have a blood ketone meter? What's wrong with me? I'm the worst. Why don't I have? So I'm online. I'm looking for blood ketone meters. Like how fast can I get one? And we just, we've never had the need. So don't yell at me. Then 2 hours later, blood sugar is coming down nicely. He's feeling a little bit better, right? Things are going to be fine. And I sit in his room and he goes to the bathroom and he comes out and he's like, wow, it's still really dark. And I look at the strip and I notice it looks really weird. We use the regular old keto sticks that have a little square at the end, and it just has one square. This stick has 2 squares, and one is dark purple and one is light pink. And I thought to myself, what the heck is this? So I look at the bottle, and if you already know what happened. I had purchased Diasticks. These are sticks that measure glucose and ketones, and the dark purple was the glucose. He didn't have large ketones. He had small ketones, maybe medium, maybe. So, big sigh of relief, and that was it. But oh my gosh, I was flipping out before that. So now we know. Now we have to be more careful. But that's the next chapter. I've already got the world's worst diabetes mom stuff ready to go. Ugh, never a dull moment. All right. A big thank you to my editor, John Buchanan from Audio Editing Solutions, as always, for helping make sense of a lot of my nonsense. Thank you to you so much for listening. Don't forget about the Book to Clinic program if you want to jump in on that, or a clinic that would like to get on the list to receive books. I'd love to hear from you as well. I'm Stacey Simms. I'll see you back here next week. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.